chronic pain is something that the medical industry has grappled with for years. And traditionally, they've used cortisone, which is an anti-inflammatory drug. They've used narcotics, opioids, and then if that doesn't work, surgery. So what we do is we identified that there's a gap where people don't get better necessarily with just cortisone and therapy, and they don't always want surgery. And so this is kind of that gap of patients who are just suffering or living with chronic pain. And taking pain meds, as we know, OxyContin and so many other pain meds, what they can lead to with addiction and all these risks. And so what we do is what's called regenerative medicine. So we use different types of regenerative molecules, whether that's stem cells, PRP, exosomes, which we'll talk about, to repair the tissue back to a previous state. So in your wife's case, she had what's called osteoarthritis, which is degradation of the joint, cartilage loss, and you get inflammation. And then she also had some small tears in the tendons around the joints. And it bothered her for 10 years, as you know. And she couldn't garden, and she loves to garden. So what we did is we used an ultrasound, as you saw, and we go directly into the tears and into the joint where the inflammation is to repair the tissue back to a previous state. And so that's how we got rid of her chronic pain.
When was the ultrasound for diagnosis?
Diagnostic and intervention.
And intervention.
Yeah.
So how does the ultrasound intervene?
Because it allows us to guide the needle directly into the area of damage.
Right. And how can you see what's damaged?
Because the ultrasound, and that's the skill. So it's telling gray from gray on
Yeah,
ultrasound.
yeah.
And that's the steepest skill set. To give you an example, I treated Mohammed Alibar. He's the guy who owns the Burj Khalifa and the 6 tallest buildings in Dubai. So he had a shoulder issue for 15, 20 years. And he did an MRI. MRI was normal. So they just did cortisone, they did physio. He was living with chronic pain for 15 years. And he's arguably he's the wealthiest man in Middle East, and he's a very well-renowned businessman. So he has access to any doctor in the world.
Right, right.
And so he found me, and I flew down, I did an ultrasound, and we found some small tears that were missed on MRI. And then we injected him, similar to what we did with Tammy, and we fixed it.